Symptoms and treatment for dengue. Dengue is a mosquito-borne viral ailment endemic in tropical and subtropical nations, and has developed as a genuine universal general well-being danger with half of the total populace of these nations being at risk of this infection. The infection with any of the 4 serotypes of dengue infection can create a wide range of manifestations, running from asymptomatic contamination to a serious life-undermining disease. Dengue fever is a mosquito-borne disease that occurs in tropical and subtropical areas of the world. Mild dengue fever causes high fever, rash, and muscle and joint pain. A severe form of dengue fever, also called dengue hemorrhagic fever, can cause severe bleeding, a sudden drop in blood pressure and death. Millions of cases of dengue infection occur worldwide each year. Dengue fever is most common in Southeast Asia and the Western Pacific Islands, but the disease has been increasing rapidly in Latin America and the Caribbean. Researchers are working on dengue fever vaccines. For now, the best prevention is to reduce mosquito habitat in areas where dengue fever is common. More than 70% of the disease burden is in Southeast Asia and the Western Pacific. In Latin America and the Caribbean, the incidence and severity of disease have increased rapidly in recent years. The African and Eastern Mediterranean regions have also recorded more outbreaks of the disease in the last 10 years. In 2010, indigenous transmission of dengue was also reported in 2 countries of Europe. Urbanization, rapid movement of people and goods, favorable climatic conditions and lack of trained staff have all contributed to the global increase of dengue. Dengue, however, cannot be transmitted by person-to-person contact, nor is it an airborne infection, unlike the common cold which is contracted through sneezing and coughing. The Aedes aegypti thrives and breeds in urban areas, wherever there is cool stagnant water available. Containers such as water coolers or desert coolers, huge pots in the garden, wells and tanks, and any other place where water can collect. Because it needs water to breed, dengue incidences are higher in monsoon seasons. The mosquito is unique in the sense that it bites mostly early in the morning or before sunset. It is believed to be most active for about 2 hours after sunrise and from several hours just before sunset. Most other mosquitoes usually are nocturnal and tend to bite after the dark. It is the female species that tend to bite the humans, since the male Aedes aegypti is adapted to survive only on fruit. The female needs human blood to ensure her eggs mature and can bite several people every time she feeds. The Aedes aegypti is very well adapted to survive in urban areas and so can thrive indoors and in dark, cool places such as cupboards, closets, below the beds and so on. The bites tend to be in the lower limbs mostly, especially ankles and feet. Symptoms. Many people, especially children and teens, may experience no signs or symptoms during a mild case of dengue fever. When symptoms do occur, they usually begin 4 to 10 days after you are bitten by an infected mosquito. Signs and symptoms of dengue fever most commonly include fever, as high as 106 F. Headaches. Muscle, bone and joint pain. Pain behind your eyes. You might also experience widespread rash, nausea and vomiting. Rarely, minor bleeding from your gums or nose. Most people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. Blood vessels often become damaged and leaky. And the number of clot-forming cells in your bloodstream drops. This can cause bleeding from your nose and mouth. severe abdominal pain, persistent vomiting, bleeding under the skin, which might look like bruising, problems with your lungs, liver and heart. Dengue fever facts. Dengue fever is a disease caused by a family of viruses that are transmitted by mosquitoes. Symptoms of dengue fever include severe joint and muscle pain, swollen lymph nodes, headache, fever, exhaustion, and rash. The presence of fever, rash, and headache is characteristic of dengue fever. Dengue is prevalent throughout the tropics and subtropics. Dengue fever is caused by a virus, and there is no specific medicine or antibiotic to treat it. For typical dengue fever, the treatment is directed toward relief of the symptoms. Papaya leaf extract can be used to treat dengue fever. The acute phase of the illness with fever and muscle pain lasts about 1 to 2 weeks. Dengue hemorrhagic fever is a specific syndrome that tends to affect children under 10 years of age. This complication of dengue causes abdominal pain, hemorrhage, and circulatory collapse. The prevention of dengue fever requires control or eradication of the mosquitoes carrying the virus that causes dengue. A vaccine for dengue fever was approved in April 2016 for use in dengue endemic areas. Causes. Dengue fever is caused by any one of 4 dengue viruses spread by mosquitoes that thrive in and near human lodgings. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters that person's bloodstream. After you've recovered from dengue fever, you have immunity to the virus that infected you but not to the other 3 dengue fever viruses. The risk of developing severe dengue fever, also known as dengue hemorrhagic fever, actually increases if you're infected a second, third or fourth time. Dengue doesn't have a specific origin, though it is said to be originated from by Swahili word kadinga which means cramp-like seizure caused by an evil spirit. According to a source, the first ever reported case of dengue dates back to 992 under the Jin dynasty. It was referred to as the water poison by the Chinese encyclopedia. A physician named Dr. Jose Sabater in 1771 gave the name break-bone fever, which meant the bone and joint pain with high fever. The first clinically recognized dengue epidemics took place almost simultaneously in Asia, Africa, and North America in the 1780s. Dr. Benjamin Rush, who recorded the first case of an epidemic disease in Philadelphia back in 1780, gave the term bilious remitting fever. The symptoms that followed this disease were high fever, joint pain, rashes, headache, bleeding, vomiting, nausea and weakness. Treatments. No specific treatment for dengue fever exists. Your doctor may recommend that you drink plenty of fluids to avoid dehydration from vomiting and high fever. Acetaminophen can alleviate pain and reduce fever. Avoid pain relievers that can increase bleeding complications such as aspirin, ibuprofen and naproxen sodium. If you have severe dengue fever, you may need supportive care in a hospital. Intravenous fluid and electrolyte replacement. Blood pressure monitoring. Transfusion to replace blood loss. Fortunately, this viral disease is usually self-limited, and usually adequate hydration and pain control will help the person through the infection. However, for dengue fever, a caution is given by most doctors regarding home treatment. Non-steroidal anti-inflammatory agents should be avoided because of the tendency of the dengue viruses to cause hemorrhages. The NSAIDs may add to the hemorrhage symptoms. Other medications such as acetaminophen, codeine, or other agents that are not NSAIDs may be used. More severe variations of dengue fever usually require additional supportive treatments. These patients often require hospitalization. For fluid hydration, blood transfusions, platelet transfusions, blood pressure support, and other intensive care measures may need to be utilized in these patients. Consultation with infectious disease and critical care specialists is often advised to optimize patient care. Management of dengue. If dengue has been diagnosed, maximum bed rest and avoidance of physical exertion should be ensured for the patient. Use paracetamol as recommended by your doctor for pain or a headache and avoid self-medicating with unknown painkillers which can increase your risk of bleeding. Drink lots of fluids to prevent dehydration which can result from the high fever and vomiting. Eat a balanced wholesome diet rich in fruits, vegetables, and whole grains. Include plenty of milk and milk products to ensure your immune system is well equipped to fight back the infection. Use mosquito repellent sprays and creams for the rest of the family members to ensure they are not infected. Use mosquito nets in the night and discard any containers or pots that have stagnant water. Consult a doctor if the fever does not subside or other symptoms are noticed. Ensure doors and windows have netted screens that prevent mosquito entry into the house. Wearing protective clothing will help prevent further infections. Long sleeves, full pants, and socks would help avoid dengue mosquito bites. Avoid travel to known dengue endemic regions, especially in humid, warm or wet seasons. Prevention. Exclusion from childcare, preschool, school or work is usually not necessary, but people experiencing fever from dengue infection should not be in an environment where they may be bitten by mosquitoes. If this is not possible, they should stay at home until they have no fever and are therefore no longer infectious. There is no vaccine to prevent human infection by this virus. Personal protection and the environmental management of mosquitoes are important in preventing illness. Prevent access of mosquitoes to an infected person with a fever. Protect yourself from mosquito bites at all times in dengue areas. For tips on how to protect yourself, see Fight the Bite. Dengue fever is transmitted by the bite of an Aedes mosquito infected with the dengue virus. The mosquito becomes infected when it bites a person with dengue virus in their blood. It can't be spread directly from one person to another person. Stop mosquitoes in their paths. In a country prone to pests, there are products available in abundance that can prevent mosquito bites. Put insect repellent on both your skin and clothing. The most efficient repellents contain DEET-1. Apply permethrin on your bedding. Wear clothes that cover your arms and legs. Use mosquito nets that are insecticide treated. If available, switch on the AC and shut any window screens. Get rid of every mosquito breeding areas. Generally, dengue fever will subside within 2 weeks of contracting the disease, and in severe cases it might stay for a longer duration and end up requiring hospital treatment to replenish lost fluids. There is no exact cure or vaccines for the virus, but it is imperative for you to inform your healthcare professional as soon as the symptoms start to display. Medical treatment will help in managing any discomfort and lessen any risk of complications.